If you took the shot, you still could get measles. So we have measles outbreaks. And on top of that, there's, like any drug, there's always risks and benefits. So what's the risks of the measles vaccine? This is important. This is another one that's on the Zenodo server, you guys. We just came out with this. We analyzed how many babies died after the measles vaccine, the MMR vaccine, since the 1990s. Answer, I think there's over 100 kids, maybe 200 kids died.
From the vaccine?
It was a combination of vaccines, but they found them dead in their bassinet. How many people died of measles during that same time? About 6 or 8. You get the exact numbers if you guys go on the server. So there are risks. That's the point. Nothing is risk-free. Let me give you another one.
Well, right there, what you're saying is, yeah, it's effective.
Yeah, it drops the case count, but you could lose your baby with it.
Got it.
Okay. Now, what about chickenpox? I had chickenpox as a kid, but my kids didn't get chickenpox. They took the shots. So chickenpox lowers the case count. Terrific. But what's the catch? There's always a catch. That's the point. The catch is that now there's a higher rate of adult shingles if you take the chickenpox vaccine.
So you're really just pushing it down the road then?
Well, it's a trade-off. It's a trade-off.
Who doesn't want chickenpox? First of all, you get out of school for like 2 or 3 days.
And you get permanent immunity. So there's always a trade-off. So there's an important paper in JAMA recently by Vesuvian, V-A-S-E-D-U-V-A-N, that said a large number of parents now are not going to get their kids fully vaccinated. They've seen enough of this now. There's been
Is that alarming to you, or how does that look to you?
Well, I think it's going to bring us back to a more appropriate use of vaccines. Now, I'm not against the use of vaccines. I took every vaccine known to man except for the COVID shots. I've taken all kinds of flu shots. My kids took all the vaccines, so I'm not against vaccines. But I think they're excessively used. And where we're going is what's called risk stratification. That is, there has to be some meaningful risk of the disease for you to take the shot. So let me give you an example. If you've had your spleen taken out, you had a car accident, you got taken out, or taken out for other reasons, like my brother-in-law had his spleen taken out, you can die from a pneumococcal infection, meningococcal infection, or Haemophilus infection. It's called encapsulated organisms. I feel very strongly if you've had your spleen taken out, you should get those vaccines because it's compelling. It's like you don't have a chance. I've seen some patients go down with these infections. However, if you're young and healthy like you and I mean, come on. I mean, we're not. I mean, you're not gonna go down with a pneumonia. It's just not going to happen.
Yeah.
Let me give another example. This came up recently. A healthy baby born where the mother is negative for hepatitis B, the baby is fine. The baby has 0 chance of getting hepatitis B until they get into teenage years. And even then, they're probably going to be fine. Depends on what choices they make with IV drug abuse and sexual partners, what have you. It's just not compelling to give them the hepatitis B vaccine. Now, I took it myself when I, went into medical school and I was going to work with blood and what have you, and or a paramedic or a police officer. But not every person needs to take the hepatitis B vaccine. I think it's compelling. The highest risk for hepatitis B, transmitting it to the baby, is in about 20,000 mothers who have active Hep B. Most of them are immigrants, by the way, from outside the United States. They come here, they have Hep B, they're going to give it to the baby. And so when that occurs, the mother gets the vaccine, the mother gets a drug called fasinavir, and the baby gets hepatitis B immunoglobulin, and the baby gets... So we have, for 20,000 babies out of the 3.3 million born, we have a good hepatitis B transmission. It's very effective. It's 90% effective. But it doesn't have to be applied to all 3.3 million.
Got it.
So
yeah, I agree.
Recently, even Rand Paul said this, others said that, listen, we're overdoing vaccines. So I think where we're going is risk stratification. One that's going to come up, you're going to hear about it, is actually the human papillomavirus vaccine, HPV.
Yeah, I've heard about that.
Again, that's sexually transmitted, and it's given to all children in teenage years. But I can tell you, what the most compelling group is that transmits this virus like you cannot believe? Gay and bisexual men. anal intercourse, unprotected, watch out, anal carcinoma, penile carcinoma, etc., and oral head and neck cancers. So the bottom line is, HPV vaccine, yeah, gay or bisexual man, for sure.
Everyone, probably not.
Everyone, it's got to be an individual decision. So we have to get to risk stratification and freedom of choice as opposed to putting it on the government schedule and forcing it into people.
The CDC recommends routine HPV vaccinations for preteens at 11 or 12 years old, but it can be started as early as age 9 with the goal of protecting them before exposure to HPV, as it works best at younger ages. But here's one question I have. At a certain point, wouldn't some of these drug companies or these if there's a bigger entities out there that are this cabal of control, wouldn't they, is there more money in you battling these diseases over time than there is just in one vaccine? You know what I'm saying? Like, wouldn't it then on them tabulating how much money they could make off of a person, wouldn't it be like, oh, well, it's better if we have them battling these two diseases or instead of getting a vaccine early? Does that make sense?
No, the question is good. If you're a drug company and you say, I've got two choices, I'm going to make a vaccine or I'm going to make a drug to treat the disease, you would take the vaccine every time. Because the vaccine, let's say a universal vaccine like influenza, you're going to give it to 300 million people. That's 300 million doses.
Got it.
If you get influenza and severe influenza, you'd have a drug that's maybe given to 50,000 people. It's night and day.
So then right there, that should be information to us that makes it, like, it makes more sense then if you're like, well, let me just wait and see what 50,000 people would have these symptoms or get this, it feels like.
From a public health perspective, my view on this is that it should all be about treatment, right? I mean, so, have you ever gotten influenza test positive?
No.
Ever? You've never even gotten it or tested for it?
I don't have it.
Okay, you never have?
Never have.
Have you ever taken an influenza vaccine?
I don't know.
I can tell you, that shows you it's completely irrelevant to you. I've never had influenza and I've never taken the test.
I've never even met anybody that's even said it before.
Right. So my point is, why is it recommended for you, me, every human being on earth, including little babies, every year?
But is the reason why we're not talking about it or anything or know anybody that has it because it?
Well, you don't take the shots.
Oh, that's right. But did I once get it when I was a child? That's what I'm wondering.
What I'm saying is it's an annual risk.
Oh, I didn't know that.
Do you see what I mean? So it's an annual risk. So the point is, the fear of infectious diseases is grossly exaggerated.
Got it.
To promote vaccine uptake. Vaccine mythology and ideology has been going on for 300 years. This is medical religion. Mm-hmm. This is medical. Do you know some doctors will throw a patient out of their office if they don't take a vaccine?
Wow.
Yeah. Pediatricians will. They'll say, listen, if your kid doesn't take a vaccine, they're out of here.
Oh, yeah. I've seen people fighting about that online. Like, I didn't want my kids to have the vaccines and this is how they treated us.
Can you imagine? I prescribe blood pressure medicines. If you don't take this blood pressure medicine, I'm throwing you out of my office.
Yeah.
I mean, this is, it's insane. It's a religion. And how the ideology works is like this, that there's always been historically tremendous fear of infectious diseases and that we're vulnerable. We're vulnerable. But through the brilliance of man and vaccines can improve upon God's creation. Man outdoes God with vaccines. This is very important. And because the vaccines aren't perfect, we all have to take them. And because this is such a laudable goal for humanity, if some people are injured or disabled or died of the vaccine, they should take it for the betterment of humanity. They should take it for the team. It's collateral damage and it's acceptable in the eyes of this vaccine ideology. It is a runaway freight train. Look at the front of our book. Look at the coin on the front of the book. Look at the iconography. That's a boy.
Yeah.
This is a 22 euro coin issued by the Vatican. That's a boy in the tripartite imagery.
Oh, there's a boy getting a vaccine. This coin was issued by the Vatican?
Yeah,